Good evening. How's everyone doing? Good. Wonderful. Well, welcome. A Monday evening, right? Taking some time out of your busy schedules to come and learn how to keep your heart healthy. And we got some great content. In fact, I had a lot of trouble tapering down the content tonight to fit it all within an hour. So, but we managed to do it, and I really want to keep things solution-oriented for y'all tonight. So I think there will be a lot of people that will have a little bit of the shock and awe factor going as we go through what some of the evidence and what some of the research shows and how to keep your heart healthy and well, because it flies in the face of a lot of what is taught conventionally. And I just want to open up by explaining why that is. And you have to understand the difference in the approaches here, right? When it comes to approaching our healthcare, there's two main schools of thought. The first school of thought says, hey, you know what? Our bodies are made up of a bunch of individual parts that are going to inevitably break down. And when they do break down, then we have this science called medicine that gives us drugs or shots or surgical procedures to try and manage the process or slow the breakdown. Right? But we're never really, in most instances in this theory, we're never really looking to actually heal the body fully. We're never actually looking to get it well, but the goal is more to manage the disease, and that's especially true of the chronic diseases and what we're talking about tonight, right? The second school of thought would be, hey, you know what? We get the fact that we're not going to live forever, right? Research is in. We all got to go at some point, all right? But why wouldn't we look to take care of the body as best as we can? Because we believe that the body has an innate capacity to heal itself. And that if we can empower those healing systems, then that will help us avoid a lot of unnecessary sickness and suffering, disease that we see today in society. Does that make sense? So the main system and conventional approaches, which school of thought do they operate in? Mostly over here, right? We're just managing the disease. So in other words, we've seen a link between cholesterol and cardiovascular disease. Therefore, take this medication to lower your cholesterol and we'll manage a lower cholesterol. And the theory is that that should keep your heart healthy, keep your cardiovascular system healthy, keep you from having a stroke or a heart attack or a cardiovascular event, right? Well, I'm going to show you tonight how not only is that not entirely true, but it's falling well short of what the design and intention of what we really could be achieving here in regards to healthy heart and keeping your body well. But you got to have the right mindset. You got to have the right approach. So what does that look like? Well, number one, you have to believe that your body can truly get well and that it can heal, right, Chris? Right? And so, you know, no matter where you are in the spectrum, Chris was only a couple weeks out from having a pacemaker put into her heart. And she started applying some of the principles that we're speaking of here tonight. And she's allowed me to share her story many times before, so I know that that's okay for tonight. And she's well. You know, she's no longer worried about getting a pacemaker put in because her body is functioning and healing correctly now, right? And so that's really the underlying theme of what we want to do. You got to understand that the goal is to get to the cause, not just treat the symptom. Okay, and that's again something that will make conventional mindset head spin, right? Because it's never really about getting to the cause. And many times patients will go in and say, well, hey, this is what my doctor, my chiropractor is working with me to get to the cause on this. You know, and I've actually had a lot of back and forth lately with patients that are trying to work through their MD. They're working through what we're trying to do. And I had a patient come in and tell me today, well, my doc won't let me get off my cholesterol medication. And he's been making changes for over a year, and his cholesterol numbers have steadily done this. So not only has that improved, his inflammation profile has, and I'm going to show you why that's so important tonight, right? His energy is increased. His body's doing better all the way around, but the doctor refuses to reduce or eliminate any of his medication. Is that a problem in your mind, right? And for me, that's an injustice. And I told him, listen, you need to look for a doctor that's willing to work with you in that regard, right? That's our job as doctors. We're teachers, and ultimately our job is to educate you as people in what to do for your body, what's going to get you the best results, what's going to get you the results that you long for. And so if your desire is to be on medication for the rest of your life, then what I'm going to be talking about tonight for you is really not going to apply very much. But if your desire is to truly be well, and you're willing to make the hard look in the mirror and maybe make some choices and some changes to your lifestyle and what needs to happen to actually make that happen, then you're in the right room here tonight. Okay, so that's the mindset as we get into approach this. The second part of the mindset that I want to speak to is this. I've had a lot of requests for what to talk about here tonight, and we're not going to get in just for the sake of time, going to be able to get into all of those different areas or all of those things. But what I wanted to do when I was looking at the content of what we could potentially talk about in this topic matter, which is just large. There's so much information right now. It's almost tiresome to try and keep up with it in regards to cardiovascular health, right? I wanted to keep it solution-oriented. Does that make sense? Because we know that there's a lot of problems. There's only 1 or 2 slides that I'm going to talk about the problem of heart disease. The rest is all solution-oriented and helping you be able to overcome this thing. Is that agreeable to everybody here tonight? Okay, so let's move forward here so I can help you. So then what is the problem? Well, 600,000 people per year die of heart disease. To me, that's a problem. That's way too many. That ends up being 1 in 4 deaths right now in the United States. You may not know this, but heart disease is the leading cause of death for both men and women. Did you know that? Okay, so in October, when all those pink ribbons are flying around, we may be led to believe that the leading cause of death in women is what? Some kind of cancer, right? But it's actually heart disease. More than half the deaths due to heart disease in 2009 were men. Coronary heart disease is the most common type of heart disease, killing nearly 380,000 people per year. Every year, 720,000 Americans have a heart attack. That's way too many. And I'm going to show you tonight statistically how the common theory of clogged artery causes a heart attack is the smaller side of the percentage of what's really causing this issue. So that's 720,000 too many in my opinion. Of those, 515,000 were first heart attack and 205,000 happened in people who have already had a heart attack. Coronary heart disease alone costs the United States, get this, $108 billion each year. The American Heart Association estimates that cost will surpass $1 trillion over the next 10 years. Now, to me, the number isn't as important as what does that tell me is happening to this problem over the next 10 years? Is it getting better or worse? Worse. Are we coming up with better solutions or worse solutions? Worse, because it's just going to keep costing more and more and more money, right? This total includes healthcare services, medications, and lost productivity. So the American Heart Association itself is admitting in this quotation that we're not on top of the problem. We're not adequately solving this. In fact, we're predicting it to get almost 10 times worse in the next 10 years. So at some point you have to say doing the same thing and expecting a different result from what we're seeing is insane. You would have to continue to do what we're seeing conventionally and expect a better result or expect it to not happen to you would be ignorant at this point, would it not? Because if you want something different, then you have to do something different. And so that's what I want to show you here tonight is that what the experts in the CDC is recommending right now will never actually allow you to overcome this issue. It's never going to fix the problem because it doesn't get to the cause. Here's some of the CDC's tips to protect your heart. Follow your doctor's instructions and stay on your medications. Does that mean we're ever getting well? No, they self-admit it right there, right? Eat a healthy diet that is low in salt, low in total fat, saturated fat, and cholesterol, rich in fresh fruits and vegetables. Only one of those do I actually agree with. Which one do you think it is? You guys nailed it, right? Take a brisk 10-minute walk 3 times a day, 5 days a week. Okay, thumbs up there, right? Don't smoke. If you smoke, quit smoking as soon as possible. Okay, I can agree with that one as well, right? Then listen to this. Expect to treat high blood pressure for life. This is right on the website, okay? Last reviewed on August of 2014. Doctors sometimes reduce their patients' drug dosages after achieving normal blood pressure and maintaining it for a year or more, although rarely is treatment stopped entirely. Some form of treatment must be continued over a lifetime for good results. Coping with the inconvenience of medication is much better than suffering a stroke or a heart attack. I do agree with that. Most people who follow their treatment plan and successfully manage their blood pressure live a long and healthy life. Well, we may need to redefine what health means, right? Because as soon as you're taking a medication, does that mean your body is healthy or is it sick? It's sick. So you may live a long life, but it's impossible to actually have a healthy life if it's medicated. And I want you to fully understand that, because what you'll see tonight is that this is a perpetuating cycle that we're leading ourselves down. Because as soon as you take one medication, because that in and of itself is a synthetic chemical, if that medication is planned to be taken for the rest of your life, then it is chronically causing what inside of your body? Other sicknesses and diseases. Do you get that? Okay, because there's no medication on the planet that doesn't have what? A side effect. That's exactly right. It has side effect. It has to have a side effect, and so it has to be causing other sicknesses and diseases in the body as well. So then we get into the whole concept of cholesterol. Is cholesterol the cause of heart disease? Many have been led to believe so. Have they not? What if I told you that we were going to treat your heart disease with this cutting-edge treatment that I've just discovered, but this treatment, at the end of the day, was less than 1% effective in actually helping you avoid a heart attack, a stroke, or other cardiovascular event? Would you be willing to accept that treatment? Okay, now what if I told you on top of that, that not only was that treatment less than 1% effective, but that treatment also has been shown to cause over 300 adverse side effects and adverse responses inside of the body, harmful effects in the body, proven by over 900 scientific studies. Now are you ready to take that medication? What if I then told you that that medication disrupted your hormones, and in men it decreased testosterone and infected libido? But don't worry about that, because there's a dozen other medications like Viagra and Cialis and things that'll fix that problem too. Now are you ready to take this medication? No. Does anyone know what medication I'm talking about? These are called statins. This is cholesterol-lowering medication. Yet, if I can convince you that cholesterol is the cause of heart disease, and that if you just simply lower your cholesterol with these medications, then all your problems will be solved, and you'll look like the people on the commercials, right? That frolic through the woods, right? If I can convince you to do that, then you will take this medication for the rest of your life, regardless of the adverse effects that it starts causing in your body. I've seen this before in people, and I will send them the research articles. They will read them for themselves, and they will still not stop taking that statin medication. Because why? Because they're afraid. Because they've been led to believe that that medication is what's going to save their life. And they've been falsely led to believe that. And I want you to understand that that's not true. And that's not what actually is going to keep you well. And I hope that you signed up on the email newsletter if you're not already, because I will send you the studies that prove that. But listen to what it has to say here about, and by the way, this is written by Kelly Brogan, medical doctor. Okay, so this isn't, don't believe the chiropractor that's talking about how medications are bad for you, right? This is medical doctor research that's been put out here. Over 300 adverse health effects, 80 studies linking statin medication to muscle damage, 54 studies here to nerve damage, 32 studies to liver damage, 16 studies to endocrine disruption. That's your hormone systems getting all messed up. 9 studies saying that statin medications cause cancer. 8 studies saying it causes diabetes. 15 studies saying it actually causes damage to the heart as the muscle tissue. So we're taking this medication to protect us from an adverse cardiovascular event, and it's causing what? Damage to the heart tissue. 11 studies saying that it causes birth defects. So, I will send these 2 articles to you that actually has links that goes to every single one of those studies. Don't take my word for it, but again, I want to keep things solution-oriented, and that's all about what the problem is. And so if you want to investigate that more on your own, by all means, do it to your heart's content. There's over 900 studies listed there that you could read. Okay, so you could do that for the next 5 years if you wanted to, right? But let me tell you this, there's a better solution, okay? And if that's what you're here for tonight, then that's what I want to grant you. So cholesterol is not the cause of heart disease. In fact, cholesterol is an absolutely critical nutrient for your body's health and wellness. Did you know that? Cholesterol is needed to manufacture hormones. So when we lower cholesterol, what does it disrupt? The endocrine system, the hormones, and research just showed that. It disrupts our bile acid. It disrupts our ability to create vitamin D. And we all know the benefits. If you've been around at all, you know the benefits of vitamin D, right? You live on planet Earth, you know the benefits of vitamin D by now, right? You cannot make estrogen, testosterone, cortisol, a whole host of other hormones without cholesterol. So is cholesterol good or bad? Good. It's good. Is there any such thing as a bad cholesterol? No, there is not. That's what we've been led to believe. I want you to throw the whole notion out that there is good or bad cholesterol. Cholesterol is good. Cholesterol is produced by your body. Now, can you have good and bad levels of different cholesterols? Yes, that's where it comes in. But there is no such thing as a good or a bad cholesterol. Okay, I want you to understand that. All right, cholesterol is a healing and repair molecule inside of your body. And I'm going to show you that, and I'm going to prove that to you here tonight. So when you hear of the term HDL, known as the good cholesterol, or LDL, known as the bad cholesterol, I want you to start to throw that terminology out. I'm going to show you some testing that's going to be much more beneficial for you to start asking your doctor to test your inflammation levels, because that's actually going to help you understand what the cause is. And then we're going to have some other testing that will show you some other causative factors as well. If you are taking a statin medication, have taken a statin medication, or would ever consider taking a statin medication, then you need to be taking coenzyme Q10. Why? Because that medication directly depletes your levels of coenzyme Q10. Why is that absolutely critical for the health of your body? Coenzyme Q10 is responsible for energy production within the cell. And when you don't have adequate levels of coenzyme Q10, then energy production dwindles. When a cell can no longer produce adequate levels of energy, it becomes worthless. It becomes useless. It actually dies off. This is one of the reasons why statin medications are so toxic to cells. That's why they disrupt so many different functions that you just heard about within that research study. Does that make sense? You have to replenish your levels of coenzyme Q10 if you want the muscle aches to go away, if you want to get the hormonal systems back on track, if you want to get the libido stuff working again. You've got to get the energy systems functioning correctly. Then we can start the building blocks with the other stuff. The other enzyme, the other nutrient that it depletes is selenium. So you need to make sure you're getting adequate levels of selenium as well. We have coenzyme Q10 here for you tonight. If you are not currently supplementing with that and you've been on a statin, pick some up. You need to get on it right away. High blood pressure is a warning sign. Increased blood pressure is an indicator that there's thickening or blocking of the arteries. So what happens in an artery when it starts to get damaged, right? So the cause of heart disease is actually this, and you can write this down. It's actually inflammation. So the whole name of the game here tonight, the solution, how do we calm and quiet inflammation? How do we control inflammation within the cell? If we can control inflammation, then we can actually allow the body to heal from this issue. And then we got to stop the things that are disrupting that healing process that innately occurs inside of our body. So remove the interference, allow the body to reestablish proper healing, calm and quiet the inflammation. Those are going to be our 2 big key factors, all right? So let's process through blood pressure. There's many causes to blood pressure issues, but here's one of the biggest ones. It's relation to cardiovascular disease. When you look at the way that an artery is designed, let me see if I think I have the slide here in a second. Yeah. When you look at the way that an artery is designed, see the tube shape there, the lighter pink inside is actually where the blood and the nutrients flow through. In a normal healthy artery, shoots right through, right? If you need to get more blood flow to an area, the artery can expand If it needs to increase the pressure into a certain tissue, the artery will contract, increase the pressure into that tissue, right? So for example, I'm a football player and I need to go run a sprint 100 yards down the field, right? What's that going to do to my blood pressure in my muscle tissue, right? I want the blood pressure in the muscle tissue to increase, but do I need my digestive system at that moment in time? No. So the digestive system, the blood pressure is going to decrease there. Does that make sense? Okay, so there's a regulatory system that controls and coordinates all of this inside of our body. Now what happens is when we have chronic inflammation, our body stays inflamed for a really long time when it's not supposed to, then it starts damaging the blood vessel. So if I were to go inside the blood vessel with a little mini sword like a ninja and just start slicing in the side of the vessel wall, there would be all these open gaping wounds inside the vessel. Okay, we're going to call that vascular damage at this point, just so you can get the picture here, right? When we have open gaping wounds like that inside of the vessel, cholesterol comes to repair the open gaping wound. So if I had an open gaping wound in my hand here, let's say cholesterol comes, right, and it deposits itself right inside the wound to stop the bleeding, stop the open wound. Is that a good thing or a bad thing? Good. That's a good thing, right? That's exactly what we want. However, since cholesterol is such a dense, bulky molecule, it starts to clog up a portion of the artery when it deposits itself into the artery wall. The other thing that happens is if you have a big open gaping wound on your arm and that heals over time, what does it leave? Scar. It leaves a scar. Now, is scar tissue as pliable and flexible as the original tissue? Many times no. In fact, I have, those of you that have heard my story, when I was in a motorcycle accident, right, and I slid across the pavement, I have like alligator skin here on this side of my body because when it's scarred over, my body said, hey, you know what, we're going to build a lot thicker skin, so if you're going to be dumb enough to go do that again, then maybe it won't hurt as bad next time around, right? So it's a thicker, less pliable, denser tissue in the scar tissue, right? So over time, as the vessel gets more and more and more scarred, not only does that close down the lumen, which is that hole, when you close down the hole of the vessel, right, so if you have to push the same amount of fluid through a tube that's this big versus a tube that's this big, which one is going to, what's that going to do to your blood pressure? What's that going to do to the pressure, right? It's going to skyrocket it up. Does that make sense? So as the vessel becomes more damaged and it becomes more scarred, it starts to constrict over time, and what happens to blood pressure? Okay, now you understand chronic blood pressure issue, right? You can have acute blood pressure from a stressful event. You can have acute blood pressure from a lion chasing you in the zoo. You could have an acute blood pressure rise from all kinds of things. But chronic high blood pressure is going to be caused primarily by a hormonal disruption and by this, what you're seeing right here, okay? So we got to fix that stuff from the inside out. It could be chronic high blood pressure could be caused by a misalignment in the spine that disrupts that reflex that controls how much the vessels are going to be constricted or open, right? We talked about that reflex. Now as the vessel continues to get scarred over and more inflamed, the artery starts to become almost completely occluded. And then what happens to that artery then when the blood pressure is so high, so chronically long, then the vessel wall, now that it's all this scar tissue, it literally busts open. It dilates. And that's called an aneurysm. Have you heard of an aneurysm before? Yeah. Okay, the reason I'm so passionate about cardiovascular disease is because of aneurysms. And the reason why I'm so passionate about aneurysms is because that's what caused my grandmother to pass away way before her time. Okay, she was walking through the mall with my grandfather, and her aneurysm burst, and it started hemorrhaging in her brain, and it was 2 minutes, and she was gone. I mean, literally by the time the ambulance got there, they already called it. It was that quick. Now, my grandmother was a nurse for over 30 years. She was head nurse at a hospital down in Florida, and she was the kindest, most caring woman that you'll ever meet. She was amazing. She had plaques and rewards and stuff all over this one room in her wall. It was like her workspace, her office area, and it was because she had donated so much blood every single year. So she literally believed in the work that she did. She followed her doctor's recommendations to a T. She was just really ardent about that. She gave blood all the time. She always took her medication every single day. But they never told her how to eat. And they never told her that she needed to take care of her spine and her nervous system. They never told her not to put toxins in her body, so she smoked almost her entire life, because back then it was cool. Nobody thought anything was wrong with it. In fact, it was doctor recommended. 4 to 5 doctors recommend Camel cigarettes or Marlboro Man or whatever it was, right? It was absolutely insane, right? And so Grandma passed away well before her time. That's my dad's side of the family. It wasn't short after that my grandfather passed, because he had lost his wife of 50 plus years, right? And so on my mom's side of the family, my grandparents are in their 80s over there, and they literally drove up last summer from Florida in their minivan, my 80-year-old grandpa, right? All the way from Florida, Wisconsin, and they got to meet my daughter and my wife, and they got to see us get married, and my other grandparents never got to see any of that, right? That's why I'm so passionate about this. Because it claims way too many lives, but Grandma didn't know any different, right? Nobody ever told her any different. And she believed in a failing model. She believed in a failing system. And that was her only downfall. Because if she would have believed in the principles and the model that I'm sharing with you here tonight, I know that she would have been just as disciplined and dedicated in fulfilling that model as she was in her other model. But she had a faulty model. And many times when you have a bad map, right, when you have a bad model like that, it could take you to the wrong place. You find yourself in a place you never intended to go, right? And so I'm telling you tonight, this conventional system of treating and managing the disease, that's a bad map, right? You need a new map. And so this is why we get to the cause of the inflammation. Is that starting to make sense now as to why that is? So cholesterol is not the cause. So let's stop vilifying cholesterol. Where's got the cell phone? You can go ahead and mute that. Oh, is it outside? Oh, it's the clock. Well, somebody knock that clock off the wall or something. Just kidding. Don't do that. But we vilify cholesterol, right? And the reason for that, there was a guy that Dr. Keyes originally came up with the study that showed that if you ate too much saturated fat, increase your cholesterol, and that linked to heart disease, right? But he only looked at the countries where that data pattern was true. All the rest of the data he threw out because it didn't match his model or his theory. So it was all based off a fraudulent study in the first place. And then the second theory that kind of supported it or made sense is that when they would autopsy somebody and look in their cardiovascular system, if they had dropped dead of a heart attack, what did they find? They found cholesterol there, right? And they said, oh, so that confirms the theory. Cholesterol must truly be the cause of heart disease. The problem with that, though, is very similar to if you went, when your house is on fire, who comes to your house, hopefully, to put the fire out? The fire department, right? And what are they going to do? They're going to bring their axes and their fire hoses, right? They're going to chop out the windows. They're going to spray everything down. Hopefully, they get to save your house, right? Now, if your house is not on fire, do you want the fire department to come and chop out your windows and spray down your house? No, nobody would. So sometimes things that are really good in a crisis or emergency are not really good in a time that's not a crisis or emergency. But what if somebody in the community said, hey, you know what? Every time a house goes on fire in our neighborhood, the fire department's there. The fire department must be causing all these house fires. What would you say to that person? You would say that's ridiculous, right? But that's the exact same thing that we did with cholesterol. And so you can see the connection there. And that's why the faulty science supported a faulty theory, which has led us to a faulty belief now that we are making all these recommendations off of, and we've admittedly stated, right, with the tenfold increase that we're expecting it to go to over $1 trillion in the next 10 years, we've readily admitted that this system is not getting the job done. It's in fact failing. So what do we do to fix this issue? This is why we recommend the 5 Essentials lifestyle, guys. This lifestyle is designed to calm inflammation. It's designed to eliminate chronic inflammation. That's why we recommend it. And inflammation is not just cardiovascular disease. So if you're sitting here tonight because you want to prevent that, but you don't have it, you're not really that worried about it, great. But over 300 different disease processes are directly linked to inflammation. Okay, so you want to live this lifestyle because you don't want to end up with any of those, right? And so in order to do that, number one, you got to have the right mindset, right? And so we've already been talking about that here tonight. Number two is your nerve system. Because the nerves control what inside of your body? Everything. So they control the healing of every organ, cell, and tissue. Maximizing your nutrition. Did you know nutrition can drive inflammation inside of your body? Yeah, absolutely. Big time, right? How about exercise or lack thereof? Yeah, exercise can actually help to calm and quiet inflammation and toxicity. So let me just get into this. Cholesterol increases due to inflammation. Inflammation is caused by medication is one of the biggest drivers of inflammation that we see in the office. Medication. So it doesn't mean just go and throw out your drugs tonight, okay? That would be irresponsible. But what you need to do is focus on getting your body healthy enough and getting to the cause of these issues so that you no longer need the medication anymore. Wouldn't that be the goal, right? Because if you're healthy enough to no longer need the medication or be able to reduce and minimize that as much as humanly possible, then that's going to allow you to minimize and actually eliminate a huge source of inflammation. The second biggest one that we see is sugar. We have a sugar epidemic in the United States, do we not? Yes. And sugar is a huge driver of inflammation inside of our bodies. Behind that is grains. We get a lot of that here as well, right? Wheat, bread, pastas, rices, a lot of refined processed carbohydrate consumption, which directly turns into sugar, which again drives the inflammatory process. And then the other big one that we see, toxicity and bad fats. Those would be the other two big keys that will drive the inflammatory process. We talked about blood pressure rising, sugars, grains, and refined carbs. The sugar issue is multifold. The base of it, though, and the reason why it increases inflammation is due to the hormonal response that occurs. Cortisol and insulin. All right, so anytime we eat sugar, there's a surge of cortisol and insulin. That causes an increase in the enzyme called PLA2, which is a direct marker of inflammation. It causes 90% of all diseases, especially cardiovascular disease. Inflammation causes damage to the cell wall of the arteries, which leads to plaque buildup. And that's what we were talking about. Remember I talked about inside the vessel, if there was a little ninja in there with a sword chopping it up and causing damage, cholesterol comes and tries to heal the inside of the lining. That's the process that we were referring to right there. We won't get into that tonight. Omega ratio, another big driver of inflammation. Fish oil, flax oil, and krill. Oh my, right? Remember the Wizard of Oz? So I thought it was going to be funnier, but it wasn't. That's okay. So what's the proper ratio for omegas? It should be at least a 2-to-1 omega-6 to omega-3 ratio, or at most, I should say. The problem is most standard Americans, when we test for that, they're 30, 50, 70 plus to 1 ratio. And so the ratio is way out of balance. And when the ratio gets too far out of balance, guess what that's driving? Inflammation. Right? Now, how many of you have had that ratio tested before and know exactly what that inflammatory ratio looks like inside of the cells? Right? Because why? Who doesn't test for that? Remember the first school of thought? Because what's the fix for that? You gotta eat right. You gotta fix the lifestyle. You may need to take some omegas, right? So if there's no billion-dollar huge cell, which they actually did synthetically make a synthetic omega. Have you guys seen that one out on the market? So instantly, all omega oils that were ever sold out of a supplement company was overall about $1 billion a year industry. The drug manufacturers make one and start getting it covered by insurance. $1 billion industry the first year. How crazy is that, right? Because of the machine that's been built in this. You guys have to understand how powerful this is, right? But they don't test or the problem is because it's so synthetic, it actually doesn't do the job that you want it to, which is reducing the inflammation ultimately because it's putting synthetic fatty acids into your cell, which actually ends up being even more damaging in the long run. So, but they don't test for that inflammatory profile, right? So here's a couple tests that you can get medically to see where your inflammatory profile is. They're actually listed, or they should be listed at the bottom of your sheet. Do you see homocysteine and C-reactive protein there? Okay, next time you go in to have blood drawn, ask for those two tests to be measured. Those two tests measure your inflammatory profile. And as long as they're drawing blood, have them take your vitamin D3 as well. Can you do that? Okay? Then we also need to know your omega ratio in order to know how to fix it properly. So that can tell us if you have an overall inflammatory issue. If you already know that you do because you got cardiovascular issues going on, you're already taking medications, you're eating sugar, you got all this other stuff going on, you're probably already inflamed, and we need to find out what's going on at the cellular level as a result for that. So we do test for that, but insurance doesn't pay for that test. They don't care about it because they don't have the solution for it, right? But that's ultimately what's going to get to the cause. Again, you have to look at what's managing the disease process versus what's getting to the cause and actually allowing you to get well and actually allowing you to heal. So here's what we test for. When we do this, it's a blood draw. It's a simple blood test that you do at home. You prick your finger, you put it on the pad, and then you send it off to the lab. They send it back to us, and it gives us all of these different ratios. It tells us your omega-3. It tells us your omega-6. It tells us the amount of trans fats. It tells us the ratios of all of those different fats and how that's related to your inflammatory profile. So it gives us a lot of information as far as what your risks are going to be for developing inflammation in your body, what your ultimate cardiovascular risks are going to be. Is that a valuable solution to you? I hope so. So if you already know that you have these inflammatory issues, the solution that we're going to be recommending is for you to get on the Pro Omega Intensive formula. The key is you need to know how much to take, though, because you don't want that to get imbalanced the other way. And I've certainly seen that when I test people. There's a rare bird every once in a while that actually has way too much omega-3. And that can be very disruptive to the cell as well. It causes the exact same types of issues. It's all about the ratio. And the reason for that is because the ratio of these fats makes up the cell membrane. And the cell membrane is what allows your cell to actually exchange oxygen and nutrients and toxins and get all that stuff through the cell membrane, right? And so you have to have the right ratio. The other one that we recommend as far as overall heart health is the HCV. And the HCV would be, it's got your tissue factors, so there's DNA and RNA factors in there. It's literally the most cutting edge product that I've seen in regards to heart health because it actually promotes healing within the heart tissue itself, within the cardiovascular tissue itself. So it's a huge advantage for people, not even just as far as if you have a cholesterol or blood pressure issue, but if you have something like an arrhythmia, or if you have another cardiovascular issue that's in motion right now, or if you never want to have one in the first place, right? So it allows you to actually be able to get healing from that. Okay, the next main solution that I wanted to get into for you was the digestive heart health link. How many knew that dysfunction within your digestive system can actually cause damage to your heart and can lead to heart disease? Did anyone in here know that? Okay, we have 1, 2, just a handful of people, right? Most people are shocked to find that out. So would it be prudent to know what the health of your gut is, not only for proper digestive and function, but also in protection of your heart? What if you've had chronic heart issues, you've made all the healthy lifestyle changes, yet you continue to have high cholesterol, high blood pressure, you're still inflamed, you wake up and you got the swollen joints in your toes and your fingers, right? What this research has shown is that possibly can be actually driven by dysbiosis, which is unhealthy gut bacteria within your digestive system. So here's what the research shows. This is about as cutting edge as you can get. This research article is from May of 2013. And so in order for that to actually trickle down into you guys and for you to see that, like from the media or for doctors to start recommending this type of stuff, how long do you think that process actually takes? What do you think? Yeah, it's usually 10 to 20 years before it actually ends up getting to you. Okay, so you're seeing something here that's well advanced above, and it's actually medical doctor research. So here's MD and MD that actually led this story. It was kind of earth-shattering research, but a gut-heart connection and cardiometabolic regulation. Basically, they were just establishing the fact that the gut-heart connection was not only for control in diabetes, but in overall cardiovascular homeostasis, for balancing the health of the heart systems. That's what that means, right? And then this next one here from 2008, so this was kind of the one that where this concept started emerging, where it first started coming becoming more mainstream. And what they found was almost exactly the same, the emerging role of the gut in chronic heart failure. Local and systemic inflammation and dysfunction of proteins may worsen clinical symptoms of heart failure. Therefore, future studies need to address the pathophysiology of the intestinal barrier, whose reactivity seems to be crucial for heart function. So how do you measure that, right? How do you check and make sure your gut bacteria are healthy? Did you know that as you sit today, you're actually more bacteria than you are human cells? Did you know that? We actually have more cellular bacteria inside of us than we do human cells. So they're important to pay attention to because they cause a lot of different issues inside of our body. And he says no back there. Go ahead, look it up. It's absolutely true. Pathogenic gut flora in patients with chronic heart failure. This one's from December of 2015. That's only a couple months ago. And it just further supports what we were talking about here. Results or conclusions. This study showed that patients with coronary heart failure may have intestinal overgrowth of pathogenic bacteria and candida species increased associated with clinical disease severity, venous blood congestion, and what's our buzzword today? Inflammation, right? And so what they found is that the dysbiosis in the gut bacteria, the disruption that was occurring there, was driving systemic inflammation in the body, which then damaged the cardiovascular system. The problem with that is you can try and calm and quiet inflammation by taking an omega supplement or by exercising or detoxing, but if you're not dealing with this issue, then you still have a big causative driving force that's still creating that issue underneath the surface. Does that make sense? So you really have to look at it from all angles to be able to get that solved. So we actually do have a test that we order that allows us to measure the specific enzymatic activity of the energy systems and the bacteria within your digestive system. And it tells exactly if that's functioning correctly or not. And again, this is the latest cutting edge testing that I've seen out on the market today. Insurance companies don't even know about this test. Nonetheless, do they cover it? But it's a test that we need to discover what the cause of the issue is and what we can do to actually help you understand how to get that well. So it measures the bacterial, it measures the yeast and the fungus to see if there's candida activity in there as well. So all kinds of amazing information that tells us whether or not you have this issue that's driving chronic systemic inflammation. And I'm going to bring Dr. Chad up for this next part. Remember how I started the talk off saying that the clogged artery theory was really only a smaller percentage of the whole story of what's actually causing cardiovascular events? Dr. Chad's going to come up and show you what the other 60%, the majority of the issue actually is, and start to walk you through that. And then I'll come back up and close this out here. So.
All right, thank you, Dr. Matt. Hi, everybody. I'm Dr. Chad. All right, so how do we connect this all back to chiropractic? Because aren't we just talking about clogged arteries? That's typically what you hear about when it comes to heart disease, heart attacks. Well, this is one of the largest studies ever done back in 2004. It actually concluded that only 41% of heart attacks actually had to do with some type of clogged artery, right? So 59% actually had to do with electrical current, electrical impulse, actually structural interference from the spine, not allowing the heart to function properly. So we want to look at the cause of the problem, and since this is 59%, obviously the majority, obviously we should look more into structural correction, chiropractic care, nerve impulses. That's obviously the majority, not quite, the clogged arteries. So really cool thing is that there's an amazing power inside our body, and that comes from our brain, right? Everybody knows this? That power allows every single organ in the entire body to proper function and heal, every cell, every tissue, every cell, every organ, right? So that power really has to come down the spinal cord, then out all the nerves. So what's going to happen if I cut the nerve to your heart? What's going to happen immediately? It's going to stop. Do you stop? Yes. Yes. Okay, very good. So you guys are smart. You guys are smarter than the MDs, right? All right, so anybody here Indiana Jones fan? Indiana Jones? Everybody, please? Nobody? All right, good. So if you haven't seen the movies, your assignment is to actually go see Indiana Jones, all three of them. Do you guys remember Temple of Doom? Remember that movie? Remember when he reached in the guy's chest and pulled out his heart? Right? It was still beating, wasn't it? Right? So there's somewhat truth to that, somewhat. There's an SA node. There's a thing that in the heart that actually allows the heart to beat. The really cool thing is that your your nervous system is actually what controls that SA node. Okay, where that comes from is actually in the upper neck here. Comes from cranial nerve 10. That's the vagus nerve. It's the wandering nerve. It goes to every single organ. That's actually there to through the parasympathetic nervous system. It helps you bring down your heart rate. It allows you to digest your food. The other side of it is actually upper back, lower neck. Right? That's actually the sympathetic nervous system. That's your fight or flight. So that's going to increase your heart rate, increase your blood pressure, so you can run away from that guy who wants to rip out your heart, right? So we want to honor this stuff, but of course, whenever we have a bad posture, right? So you got the rolled shoulders, the head forward, right? The Quasimodo posture, right? I call a lot of you guys Quasimodo, don't I? So that usually straightens you guys right up. So if you're in this position, right, all that pressure is in the upper neck and lower neck. And what's that controlling? The heart, right? Thank you. So yeah, the heart is controlled by those two areas. So we really want to make sure those things are functioning better. So one little exercise you guys can do is just use a wall, okay? Most people, they're on the wall, their shoulders are rolled, their head's forward, and I'm trying to get them to put their head on the wall, and they can't do it, right? So roll your shoulders back, get the shoulders right on the wall, get your head onto the wall. This is the posture you should be in, okay? So let's work on that a little bit. Plumb line, straight down. So that's how cool the nervous system is. So whenever you want to make sure your heart's functioning, look at your forward head posture, look at the curve in your neck. So any guests here, something that we want you to do is actually come and get your nervous system checked. And Dr. Frahm will be going over that in a little bit. So other thing we'll do in there too is a digital posture analysis. We'll take a pretty picture of you, and then we'll put little dots around you and actually show you where your shoulders are, where your head is, show you exactly how much your head weighs. It's going to show you a lot of cool stuff. So that comes from that posture I was talking about. This study right here is done in 2004. Just shows that actually if you have that hyperkyphotic posture, right, that Quasimodo posture, right, it actually has an increased risk of death due to the clogging of the arteries. Why is it clogging the arteries? Because you have added stress to your nervous system, right? So really relate it right back to your nervous system for sure. Here's another one. So if you've lost more than 3 centimeters in height, right, you actually have an increased risk of 60% increased risk of dying from heart disease or lung disease. So when you roll those shoulders forward, right, the head goes forward. Can you breathe very, very well? No, right? So get those shoulders back, get the head back, and take a big, deep breath in. Much easier to do. So we definitely want to avoid that. As an example, Dr. Frahm mentioned his grandma. I too lost a grandpa from an aneurysm. I was only 2 weeks old, burst in his sleep, had no idea, felt great, did all these things, but it was 2 weeks after I was born. So my grandma's literally lived the last 33 years of her life by herself. It's sad, but one thing my dad is basically upset about is that my grandpa never held me, okay? So I was 2 weeks old, and my grandpa's like, no, he's too small, just wait until he gets a little bit older. So of course he's gone. 33 years later, my dad's still thinking the same thing. Well, my dad never held my own son. It's just sad to do. So I've got 2 kids, 6 and 4 now, and of course the first thing my dad did was grab that baby and just snuggle right up with it. So fast forward to now though too, my dad's brother, obviously all the same genes, right? Right now my dad's brother is having heart arrhythmia, right? So what do? They go in with some type of catheter and ablage his heart. So they're actually burning that SA node, the AV node, and trying to get his heart rate to slow down, right? So actually what happened was that my grandpa had the same thing, okay? So of course, they lived the exact same lifestyle. He smoked, he drank too much, right? Did all these bad things, didn't do any type of exercise really. But now my uncle, who's lived the same lifestyle, having the same thing, so he smoked, he drinks, he has a six-pack every single night or something like that. It just doesn't make much sense. And the whole time they're saying, well, it's because of his lifestyle or because of his posture. So we link it right back to my uncle. He's got this forward head posture way out like this, and he can't do anything to get it back. And he's had probably 3 or 4 surgeries now, and they're actually looking at putting some type of pacemaker into his heart right now too. So it's just not making any sense. When it comes to nerve pressure though, so 10 millimeters of mercury, right? So that's really only the width, or sorry, not the width, but the weight of a dime. It's real light. If you just put that little bit of pressure onto your a nerve, it actually decreases that impulse, that electrical impulse, by 60%. Okay? If you put more pressure onto that nerve, it actually causes permanent damage. So we don't want to get to that point at all. We want to get as much pressure off it as possible. I remember in college, I studied physiological sciences, so I studied the normals. I studied normal values, making sure that the body's in proper alignment, proper function, proper values. So we did a study on some frogs' sciatic nerves, and we had the little muscle attached to it, and we would actually put pressure on that nerve, and sure enough, when that pressure's on there, that muscle wouldn't work. Okay, we did all kinds of other things, permanently damaged. It just concluded what chiropractic does. This was back in 1975, so we've known this for many decades now, but yet they're not teaching it in medical schools. They're not telling you, okay, instead of getting your blood pressure medication or your cholesterol medication, why don't you just get the nerve pressure off the nerve to your heart? So, warning signs, right? So if you have any of these misalignments in your spine, this nerve interference, structural interference, if you have any symptoms, we know you have this, okay? So headaches, menstrual problems, high blood pressure, depression, insomnia, sciatic problems, right? Low back pain, neck pain, dizziness, fatigue, acid reflux, numbness, tingling, asthma. This is just a very small list of symptoms that you could have because of subluxations. The scariest thing is that most of these subluxations, these misalignments in your spine, you might not have any symptom at all, right? So really, if you've had a heart attack already, if you've had any type of these symptoms, of course you definitely have to come in, but what we really want to do is prevent the heart attack, prevent the symptom, right? We never want you to have that in the first place. So if I could have gotten my grandpa into a chiropractic office 33 years ago, who knows? Who knows if he could have still been here today, could have met my kids too. So exciting stuff just to get to the cause of the problem. One testimonial I would have is Kim. Kim's been a patient of mine for a long time. At 44, she actually had a heart attack, right, at 44. So felt pretty good. Actually has a 3-year-old, so she had a baby at 41. Works at Chili's, manager there, 3-year-old, 44, had a heart attack. No pulse, unresponsive, heart wasn't beating, nothing like that. Thank God for emergency care system there, saved her life in crisis, right? They put the defibrillator in her chest after they got her functioning again. But basically, she was on a whole list of medications, of course, but she always cloggy and fogged up, just couldn't function very well in life. So luckily, I met her at the mall, right? So anybody here meet Dr. Frahm at the mall? Right? We go to the mall so much, we literally get nauseous because we're just at the mall and we don't want to be at the mall anymore. But we're looking for Kim. We're looking for people who need our help, okay? So Kim, we met her at the mall. Thankfully, she came into our office, got her spine evaluated, got it checked. We found a tremendous amount of pressure in her neck and lower neck, upper back. She started following the advanced diet, right? Started getting inflammation out of the way. Within probably 2 years of being under care, she goes back to her cardiologist, and the cardiologist was like, I've never seen this before. It's like you've made a new heart, right? So, of course, she's very excited. She tells me, I got her a little testimony and stuff like that. We talk about this on the radio all the time. Really cool thing is that she, probably a couple months ago, she told me that the defibrillator was actually recalled, right? It actually doesn't even work. right? So the cardiologist was like, you know, the heart's actually working really well. It's really dangerous to go back in there and switch these things out. It's kind of your choice if you want to, you know, get the replacement. You know, there's no cost to you, blah, blah, blah. She's like, I don't want to go through that surgery again. I'm going to continue to do this lifestyle. I'm going to continue to repair my body and heal. So that's just a testimony from Kim. You know, she's 47 now, I think, and running around with her kid, having a great time. Still works at Chili's, doesn't eat the food. but she's doing really great, and you know, for that moment of me meeting her in the mall was pretty cool. So I'm going to bring Dr. Matt back up, and he's going to show you how we can save your life too.
Yes, we have a couple different options to help you be able to get well. For those of you that are guests in the room tonight and have never been into our clinic or been evaluated before, we really need to start here with the first option of getting your spine and your nerve system checked. So for that, we have our 3-visit VIP new patient experience where you come into the office and you're going to have some of the tests that Dr. Chad was just talking about. We'll do your digital posture x-ray analysis, your digital posture analysis with the iPad picture. It literally, it's super cool. It allows us to analyze it, and you can see it right there on a printout. We do a nerve system scan with the thermal imaging to see where the interferences are, and then if needed, we're going to take x-rays to find out exactly where the misalignments are. And that also includes your first adjustment, so we can see how your body responds to getting the spine corrected, and it includes your report of findings and recommendations for what we need to do to get your spine and your nerve system structurally corrected and start getting it back on track. That's much different than most ordinary chiropractic, so those of you that are patients can certainly attest to that. It's very rehab intensive. We're not just looking to adjust your spine and send you on your way. That has some value to it, but it's in limited capacity for long-term function and healing and allowing the nerve system to work the way that it's supposed to. So we're actually looking to change the posture and structurally correct, you know, the issues like Dr. Chad was talking about, so that we can get the interference off the nerve system and keep it there. Because once you get your heart healing correctly, again, how long do you want to keep it that way, right? Wouldn't that be something that you would want ongoing? You don't want it to go back to being dysfunctional again. So that's our first option here, your 3-visit new patient experience, normally $299 at full service fees. Our February new patient special for that is just $97. Our second option is for those of you that are patients that want some of the testing that we talked about here tonight. So we talked about testing for your inflammatory profile within your cells by measuring your omegas with the blood spot test. So that's the first test that's included in that, is the blood spot fatty acids. Measures your inflammatory profile, your fatty acid composition, and what your omega ratio is in your cell. That's the first one that I was talking about there. But it also included your urine test, which is your organics assay. And that tells me exactly what your GI system is doing, whether or not you have gut dysbiosis, how severe it is, and what the treatment protocol would be for us to fix that. It's also going to tell me what your underlying toxicity profile is. So how long do we need to detox? What intensity or level of detox do we need to recommend? It's going to tell us your energy profile. So if you've been taking a statin medication, guess where that's going to be, right? Because the coenzyme Q10 is going to be depleted, and your energy systems aren't going to be working on a cellular level. So it literally measures that for me and tells me whether or not you need that and what your need is for that. And then it also measures your oxidation profile. So are you getting enough antioxidants daily? Do you have enough glutathione production so that you're protecting yourself from any other toxins that are coming into your body and filtering those off correctly? So a lot of amazing stuff there. Normally that testing in our office is $399. For you guys that decided to come out on the Monday night, right, and learn how to get your heart healthy and well, and we want to help you be able to start to get to some of those solutions, we're going to do that literally for you. This is just barely above my cost for these tests at $257. So if you have any interest in that whatsoever, the girls have a sign-up sheet, and we'll follow up with you in the office to get you your testing kits and explain how to do that so we can get the results off. You have to ship them out. It takes us about 2 to 3 weeks to get the testing results back, and then we'll put together the protocol and show you exactly what it would be to fix any of the issues that come out of that testing. And then the third option is for our first two options combined. So if you're a guest and you're like, I have cardiovascular issues, I've treated it conventionally, it's not working for me, and I need to do something different and I'm all in, that would include your 3-visit new patient special to check you structurally and develop your plan for that, and also your metabolic nutrition testing as well to tell us exactly what those profiles look like and what we need to do to start fixing that as well. So option 1, 2, or 3 is available. Normally that would be $5.99 in the office, and we're actually going to throw in, it's $3.57, but there's actually a special gift for that one as well. So any guests that do take advantage of that, that third option, then we will throw a special gift in for you there as well to do that. So we have our community dinner coming up also Monday, March 7th. And this is where there is way too many people in our community right now that are sick and suffering. How many of you know somebody that should have been here tonight? You learned something new and you know they should have been here to learn it as well. Here's your opportunity to bring them out and start to show them how to get healthy and well. We know that these folks need it. We can't get to them all, so we're just enlisting you to help us help them. Sometimes they don't even know how badly they need it, right? How many of you have tried to help somebody before and they're like, well, sounds good, but I'm okay right now. It's like, how bad does it have to be before you're going to actually take action, right? So this gives them a very neutral ground territory. I purchase the meal and take care of everything of that, but we teach them the principles of maximized living. And so the light bulb has an opportunity to click for them, and then they can follow up with us and we could start helping them advance their own lifestyle and make some of these necessary changes as well, so we could start seeing some radical transformation in our community. I mean, just think about it. How many aunts or uncles or grandpas or grandmas or brothers or sisters probably had a heart attack in our community today alone? You know, you think about that, it's mind-boggling, and it could have been prevented if they were just, here 10 years ago, right? Does that make sense? So, start getting some of this stuff moving in the right direction. So that's Monday, March 7th. You just go online to maxhealthchiro.com/events. You can register yourself and your guests there directly on our website now, or just sign up with one of our team members in the office and they'll help you figure that out as well. And then also, this is the first of the year that we're doing our workshop validation card. So a new program that we're launching in both our Brookfield and our Hales Corners locations. Waukesha has been doing this, but we've modified the program a little bit. So all the new policies of the workshop validation card, we have policy sheets for you, or we can get you policy sheets in the office. Do we bring those tonight? We do. So they have those for you. Basically, you get a workshop validation card. You are responsible for tracking it. It would be a nightmare for us to try and track all of you and who's been to what workshop and whatever. So if you lose it, I'm sorry, but that's all there is to it. So that workshop validation card is worth its weight in gold. So it will give you 10% off of next year's wellness plan if you attend at least 4 workshops this year. So there are some exclusions that apply. Makeovers and webinars did not apply to that, but you can see the policy sheet for full details. But that's just something that we wanted to do to honor y'all that come out and invest into your health and invest into your education, stay plugged into the culture of what we're creating here to help our community be well and be healthy. And we just wanted to honor you in that fashion. So please take advantage of your workshop validation card tonight. The girls will sign off on that for you, and then just bring that back to each workshop that you come, and you can accumulate those, kind of like the stamp that you get at the frozen yogurt place or whatever, right? And then you turn it in. You can't accumulate more than one card and get like 20 or 30 or 40% off, right? It's just, you get the 10%, and it's for each family member that has a card. So they do have to be in attendance and have their card signed off, but you can see all the details on the policy sheet again. And that's what we have prepared for y'all tonight. If you have any other questions or anything, Dr. Chad and myself will be sticking around for a few minutes to answer those for you. Guys, I have found historically that working with people that have cardiovascular issues, that the fundamental lifestyle changes that we teach are helpful to some extent, but it doesn't typically help people get over the hump. So if you have that issue, we really do need to get down into the nitty-gritty testing and find out what the causes are and put the right protocols together. If we're ever truly going to get you off all the medications and help you get well, you really do have to do some more advanced stuff and be willing to take it to another level. So just want to make you guys aware of that, and that's why we kept it solution-oriented that way tonight. Okay, Have a wonderful evening. Thank you so much for your time. You guys be blessed.